So I chose pulmonary and critical care because it's a very intriguing field. It allows me to take care of patients in various settings, from the clinic to the hospital to the intensive care unit. It's a field that challenges me, and I get excited to come to work every day to take care of my patients. It's rewarding. So in the clinic, I take care of patients with several pulmonary conditions, from asthma, COPD, interstitial lung disease, pulmonary hypertension, lung cancer, lung nodules, pleural diseases. If a procedure is required, I perform bronchoscopies, endobronchial ultrasounds, chest tube insertions, thoracentesis. In the ICU, I take care of critically ill patients. It's a very stressful and vulnerable position to be in as a patient. That's something I understand, and I try to empathize with my patients. When I have to perform a procedure, sitting them down and talking about the risks, the alternatives, the benefits, and drawing out a picture for them, that can go a long way in making them feel comfortable about what I need to do for them. And when I do that, I can see the patients tell me, "Doc, this is the first time somebody's actually explaining this to me in detail," and they're grateful. The team here, they're exceptional. We have a strong team of office staff as well as nurses that ensure that I walk into the encounter successful. They provide me with the right information that I need to know about the patient. The paperwork is filled. The tests that I've recommended prior to the visit have been performed. They've reconciled the medication list. That way, when I start talking to the patient, I already have a background idea of why the patient is there. So I embody the Riverside mission, which is to care for others as we care for those we love, by asking myself, prior to starting a treatment, prior to performing a procedure or referring a patient for surgery, if this were my mom, my brother, my sister in front of me, would I be making the same decision? And the answer has to be yes every time, because I take care of my patients as I do my family. I get satisfaction from my patients telling me that they're feeling better. When they come in the next visit and say, "Hey doc, that cough is gone," or "I'm not as short of breath as I was that last visit," it goes a long way to make me feel good about what I'm doing. And having family members, even in difficult situations when I'm taking care of their loved ones in the ICU, telling me, "You made everything very easy, we feel very comfortable, we're confident in the care you're providing," that's what makes everything worth it. I'm Dr. Oladunni Enilari, Pulmonary and Critical Care Specialist at Riverside.